That doesn't mean I think people are going to feel better right away. They may feel worse. They may start to feel shaky and weak, and they're going through withdrawal from their toxic diet they were eating. So they come to, let's say, our retreat, and the first week they're more headachy and fatiguing and urinating more, and they're not feeling greater. But immediately they're getting healthier, even though they're not feeling better yet. Immediately their red blood cells are not sticking together. The viscosity of their blood is thinning. Their blood pressure is dropping. Their glucose is getting better. So I see a person, let's say, comes in on 80 units of insulin a day, and immediately within 2 days, they're off the insulin, and their sugars are much lower. So we see immediate reduction of risk factors for cardiovascular death, stroke death, or some major tragedy happening to them. So being there a week could lower the risk of a heart attack by 1,000-fold in just 1 week's time. But the feeling better, where they're getting the detox out, that could take a few weeks to happen. That could take a little longer. So they might not feel better for a few weeks, but the magic's starting to happen with the first meal. The minute you start pouring that garbage and you take away the salt and the fried foods and the greasy foods and the extra, animal protein, you immediately start getting healthier biologically and safer almost immediately. What's kind of interesting is that, let's say a person eats so healthfully, they follow a Nutritarian diet, and the average male maybe loses 25 pounds the first month, and female maybe 20 pounds, and then the second month they're losing, let's say 15, the male loses 20, the woman loses 15, slows down a little bit, then 10 pounds. What I'm saying right now is a person may be doing this really adherently, or coming into my retreat and just doing it right, correctly. Maybe they lost 50 pounds in 3 months, let's say. They've dramatically affected their health for the beneficial effect because they're still 50 pounds overweight. And I mentioned that the higher levels of insulin production, the higher levels of inflammatory compounds, the estrogen production, the insulin resistance, all these things start getting better even while the person is overweight because the person is in the process of losing weight. What I'm saying right now is that a Nutritarian is a person at their ideal weight eating an excellent diet, or a person who's overweight eating an excellent diet, but they're moving towards their ideal weight. If you're overweight and you're not losing weight, then you're not going to see those anti-inflammatory benefits. You have to be overweight and losing weight. And when you're losing weight, even though you're still overweight, you're 1,000 times healthier. And your body is starting to repair things already. Even the diabetes goes away while you're still overweight. Even though you're still 50 pounds overweight, you're moving in the right direction, so you've immediately made the body much healthier. But then you go to Las Vegas and eat at the buffets, or you go to a cruise ship, and you go to a vacation and you pig out and you gain 10 pounds back. Now, you just gained 10 pounds back. You're still 40 pounds less than when you started. But because you just put on 10 pounds in a few weeks, you're at a higher risk of death right now when you gain 10 pounds than you would have been when you were 40 pounds heavier. Because when weight is coming on the body, then then these inflammatory processes are growing and you're storing more visceral fat. The fat becomes more saturated. You're putting more vulnerable plaque. And people know that most heart attacks occur after Christmas and New Year's. And when people come back from vacations and holidays and cruise ships, when they binge down and gain weight. So what I'm saying is that the danger point is to regain weight rapidly. Therefore, it's like a person goes to cocaine rehab for 3 months and then off cocaine. They go back to their neighborhood and start using cocaine again. They're at high risk of death now because they've lost their tolerance for cocaine when they were off it for 3 months, and now there's the same size dose that hardly made them high now might cause a heart attack. But the same thing is true with food, that we want people to lose weight and live in a healthy manner and continually to lose weight towards their ideal weight and not yo-yo their weight back and jump on and off fad diets, lose weight, gain some back again. And we want them to, so it's a different process here of motivating people and changing the way they eat, but also changing the way they think about the world and think about themselves. So once they keep continuing to be their own best advocate and don't self-sabotage their own progress. Because a person that's going to live in a manner to hurt themselves, that's called an addict, right? They just want instant gratification and they don't care if they hurt themselves. And people like that wind up hurting not only themselves, they're hurting the planet, their neighbors, their children, and the rest of the world at the same time. So this all gets married together. So when we're trying to deal with people and teach them about nutritional excellence, we're also teaching them a more sensible way they can be happy, feel good about themselves, feel content and peaceful, and change the way they think long term. So they behave in their own best interest, and they're more peaceful and confident and secure with their own behavior and their own actions.